In a population of 100 million Filipinos with only 60,000 active doctors, access to healthcare services is a challenging situation, especially for those living in the rural areas. Many of these doctors live and hold practice in urban areas due to the lack of infrastructure and security concerns. In rural areas, rural healthcare workers are the ones tasked to become primary healthcare providers. It all begins when the rural health worker goes to the patient's house, checks blood pressure and other vital signs of the patient, does a preliminary physical examination and proceeds to diagnose, and performs the treatment. People in rural areas travel long distances to access healthcare services, particularly specialist services. The leading causes of morbidity in the Philippines are infectious in nature, and treating these diseases at an early stage is essential for the achievement of favorable outcomes. Out of 514,745 deaths registered in 2013, almost 63% were attributed to the top 5 leading causes of death by diseases, and strengthening systems for early recognition of diseases can reduce mortality rate. In order to improve access to healthcare, we present Artemis. Artemis is an artificial intelligence-assisted decision support system that will enable rural health workers to perform early disease detection, provide proper and comprehensive diagnosis and treatment. Artemis mobile application will be used by the RHW as an electronic medical record for patients, provided with links to laboratories as well as specialists. How does Artemis work? RHW goes to the patient's house. RHW opens the Artemis mobile application, then goes to the patient's module. Then, RHW searches the patient's name to view his or her profile. RHW checks blood pressure and other vital signs of the patient, after which RHW adds new HPED and asks needed medical information. Then RHW inputs patient's answer and the vital sign readings. This information is to be sent to the referred specialist to diagnose the patient accurately. After saving, the app suggests having a potential disease. RHW informs patient that he or she has a potential disease, and RHW asks further questions, guided by the app. The app will guide the RHW to request the appropriate lab orders and procedures. RHW tells patient to go to the laboratory and have a lab test. Medical technician receives a laboratory order on Artemis web app. Patient goes to laboratory to take the needed lab tests. After the lab tests, MedTech inputs the lab results on the web app. This is also included in the information that is to be sent to the specialist. This can confirm or deny the initial suspicion of tuberculosis. MedTech marks the lab order as completed and sends the results to the Artemis mobile app. Then the app receives notification from a completed laboratory order. RHW reads laboratory results. The app suggests referring the patient to a specialist. The app lists doctors specializing on the patient's potential disease and the nearest doctor to the patient's location. RHW will select the specialist needed. The app aggregates necessary patient's information to be sent to a specialist. Then, the selected specialist receives the referral email containing the aggregated patient's data. The medical specialist will be able to retrieve the patient's information anytime, anywhere. Specialist opens patient's face sheet. Specialist reviews the patient's face sheet, then inputs his or her notes, comments, available schedule, and orders the patient to see him or her for further evaluation, then sends instructions to RHW. The app receives notification from specialists and instructs RHW what to do next. The RHW copies the specialist's notes and sends it via SMS to the patient. The patient receives the message from the RHW. The patient goes to the specialist to have a consultation.
Magandang umaga, Dr. Jerome.
Hi Danilo, nice to meet you. Maupo ka.
The specialist pulls up the patient's face sheet again for the consultation.
Sinabi ni Aling Leonora na maaaring meron kang tuberculosis base sa Artemis. So titignan muna kita.
Okay po, Doc.
Base sa mga pagsusuri, meron kang pulmonary tuberculosis. Reresetahan muna kita ng gamot at si Aling Leonora ang magmo-monitor nito. Kasama.
Okay po, maraming salamat po.
2 weeks later,
Base dito, pero hindi ka pa tapos. May iinumin ka pang gamot at kailangan matapos mo ito. Babalik ako sa susunod dito para i-remind sa'yo na kailangan mo ng uminom.
Well, I would hope one of Kaiser Permanente Colorado's visions is about meeting people where they are. And I really think that means virtual care is going to take center stage with how I deliver care for my patients, how we all deliver care for our patients. And I also think it's around, where are the places that you go on a regular basis and you would be able to get health care at all of those places.